Hello, I'm Dr. Curtis Wolf. I'm a family practice physician. I'm doing this series of videos mostly for my own patients. When we have 15-minute visits at my clinic, we don't always have time to give you all the education that one really should have about medical conditions that we diagnose. And so I hope through these videos we'll give you a little bit more information about some common medical conditions that we see every day. I decided to start off with one of the more common and serious conditions that we see every day, which is diabetes. Some of the questions that people might have after they've been diagnosed with diabetes is, what is diabetes? How did I get this disease? What can I do to control it? Why is it important to control it? What are some of the treatments? What are some of the benefits and disadvantages of different treatments? What are the consequences of not controlling my diabetes? I hope to answer briefly some of these questions today. Diabetes is definitely on the rise in the United States. I would estimate that probably about a quarter of the patients that I see every day in my clinic have diabetes. Unfortunately, the American diet and lifestyle probably contributes to that. We eat too much. We eat too much sugary and carbohydrate-rich foods, and we don't exercise enough. And as you gain weight, your risk for diabetes increases. I want to give you a brief explanation of diabetes. To understand what diabetes is, you first have to understand some basic metabolism. When we eat a sandwich or something, what happens is our body breaks down that food into its basic elements. It breaks the carbohydrates into simple sugars. It'll break things down into their simple fats and proteins. And your body needs that for energy, but it also needs to be able to store some of that energy that you've eaten. And the main way it does that is it stores the sugars in your liver and in your muscle. And when you eat, your body, your pancreas specifically, secretes something called insulin, and insulin triggers your body to take that sugar that's in your blood and store it into your liver and muscles. Your body can then slowly release that sugar that's stored in your liver and muscles throughout the day. Your body tries to maintain the blood sugar at a pretty constant level. Somewhere between 90 and 120 is where your body likes your blood sugar to be. If it gets too high, it can cause problems, and if it goes too low, it can cause problems. So diabetes is a problem with insulin function. There are two types of diabetes. Type 1 diabetes is where your pancreas no longer makes any insulin. And so you eat something and there's no insulin to tell your body to store that sugar, so the sugar stays in your bloodstream and your blood sugar goes high. Type 2 diabetes, usually you are making plenty of insulin, but your body is not responding to it. So it's a problem with insulin sensitivity. Type 1 diabetes, when they're first diagnosed, it is not subtle. They come in very sick. When you're not making any insulin, the blood sugars go up very high, and people have often lost 20, 30 pounds by the time we see them in sometimes a very short period of time. They're very thirsty. They're peeing all the time. They'll have a decreased mental status. They'll be breathing really fast. So it's usually not super hard to make this diagnosis, because by the time they see you, they are usually very sick. Type 1 diabetics, when we first see them, we almost always have to send them to the hospital. They'll need IV fluids and IV insulin to get stabilized. Type 2 diabetes, on the other hand, is usually a gradual onset, and people have often had it for months or years before we even diagnose it. Some people come in without any symptoms at all, and I just catch it on some lab work that we just happen to be doing. But if they do have symptoms, a lot of times it's just they're feeling more tired. They will be thirsty and peeing more. Sometimes they will have some numbness in their feet or blurred vision. We diagnose diabetes by doing some simple blood tests, checking the blood sugar checking something called a hemoglobin A1C, which I'll talk about later. So what are the treatments for diabetes? First of all, with type 1 diabetes, there's really only one treatment. You're not making insulin, so you need to replace that insulin. So you're going to be getting insulin injections in some form or another. Type 2 diabetes, there are several treatment options that I'll talk about. Most of them are in pill form, but there are also some injections that we use for type 2 diabetes. The goals for treatment for diabetes are to get the blood sugars down in the lower range. Just to remember, you want those blood sugars somewhere around 100. 200 is way too high. Below 70 is way too low. One of the ways we monitor diabetes is with a test called hemoglobin A1C. A hemoglobin A1C gives us an idea of what your average blood sugar has been over the last 3 months. A hemoglobin A1C less than 6 is normal. That tells me that the blood sugar has been running around 100, which is normal. If it is about 6, then the blood sugars have been running around 120, which isn't bad. If it's around 7, then they're running in the mid-100s, around 150. If they're around 8, then that tells me that the blood sugars are running in the high 100s, around 180, which is probably too high. And if it's 9, then it's probably running above 200. Anything above 9 is definitely out of control. For young, otherwise very healthy people, I like to get that hemoglobin A1C as close to normal as possible. I have patients that get their hemoglobin A1Cs in the 5s. I'm happy if they're in the 6s. They've done some studies that showed that for older patients particularly, if they get their blood sugars under too tight of control, actually their risk for dying actually increases. Probably because they're having too many low blood sugars when we get too tight of control. So for my older patients, I'm very happy if we get a hemoglobin A1C less than 8. For all diabetic patients, lifestyle modifications are going to be important. Weight loss, exercise, decreasing sugar and carbs in your diet, those are all things that can lower your blood sugar. And I do have several patients that are able to control their diabetes just with lifestyle modifications. The first medication that we will usually try for type 2 diabetes is something called metformin, or Glucophage is the brand name. And that's because it's an inexpensive medication, and it has been shown to decrease mortality. People are going to live longer if they take metformin, in other words. Some advantages of metformin is it won't make someone's blood sugar go too low. As we've said, that if the blood sugar goes too low, it's a problem also. It also helps people to lose weight. People tend to lose weight, or at least they don't tend to gain weight on metformin. Some of the disadvantages of metformin is if the kidney function has dropped too low, we shouldn't be giving metformin. Also, particularly when we first start metformin, a lot of people will get diarrhea. And that's probably the number one reason I have patients stopping metformin, is because they get diarrhea. Another common class of medication that we use for diabetes are called sulfonylureas. The one that I use probably more than any other is called glimepiride, or the brand name is Amaryl. This type of medication causes your pancreas just to squirt out a little extra insulin, lowering the blood sugar. Disadvantages of this one is if you take it and you don't eat, then it can drop your blood sugar too low. And unlike the metformin, this one actually can make you gain weight. Another advantage of it, as compared to metformin, is it is okay to take if the kidney function is not perfect. Another medication that we'll sometimes use is called pioglitazone, or Actos. It does decrease all causes of mortality with diabetic patients. Unfortunately, you shouldn't use this one if there's liver disease or congestive heart failure, and it also will cause some weight gain. A newer class of medication for diabetes are called GLP-1 agonists. You may have heard of some of these medications. You may have seen commercials for them. Some of them are Byetta, Bydureon, Victoza, and Trulicity. These are injections, but they're not insulin. Some of them are injections that you do every day, and some of them are ones that you just do an injection once a week. Unfortunately, these medications are more expensive. Some of the side effects from them can be some GI, stomach upset. A big advantage to these medications is people do tend to lose weight on these. Another class are called DPP-4 inhibitors, and you may have heard of some of these. Januvia, Onglyza, and Tradjenta. I usually use these more as an add-on to metformin. By themselves, they don't lower the hemoglobin A1C or blood sugar quite enough, but if we're just trying to get the blood sugar down just a little bit more to get to goal, these are pretty good add-ons and fairly well tolerated, although they can be expensive also. One of the newest class of medication for diabetes are called SGLT2 inhibitors. And these medications actually block the resorption of sugar from the kidney, so you're just peeing out a lot of that sugar. Some of these medications that you might have heard of are Invokana and Jardiance. You may have seen commercials for. These ones also help people to lose weight. Because there's more sugar in the urine, because you're peeing out that sugar, it makes it more likely for you to get urinary tract infections. We do use insulin for type 2 diabetes sometimes also. As people have had diabetes for several years, a lot of times the pancreas just wears out. They just can't make enough insulin. And so at that time, when people have had it for several years, sometimes we do have to start giving them insulin, sometimes in addition to the oral medications. Besides just controlling the blood sugars with diabetes, we also want to monitor and control some other things, mostly to try to prevent the complications of diabetes. One of the big things that we want to monitor and control is high blood pressure. People with diabetes are at increased risk for heart attacks and kidney disease, and controlling the blood pressure decreases that risk. Most patients with diabetes, even if they have a little high blood pressure, should be on a type of medication for blood pressure called an ACE inhibitor, which helps protect the kidneys. Other things to decrease the complications of diabetes. Quit smoking. Diabetics aren't allowed to smoke. No one should be smoking, but diabetics particularly should not smoke. Baby aspirin. Taking a baby aspirin a day is a good idea for lots of diabetics. Talk to your doctor about that. Cholesterol management. Many, if not most, diabetics should be on a cholesterol medication, the class of statins. There are medications you probably have heard of: Lipitor, Zocor, Crestor. We also monitor kidney function because diabetes will affect the kidneys. We do that through a blood test and with urine tests. You ought to get an eye exam every 1 to 2 years if you have diabetes. If you get what we call diabetic retinopathy and they catch it early, they can treat it and prevent vision loss. We also check people's feet at least a couple times a year. That's because diabetes affects the circulation and the sensation in the feet, and you can get ulcers, you can get infections in your feet, which you hear about diabetics losing their toes or feet or legs. We're trying to prevent that. So I hope that gives you a little bit more information about diabetes and what we're doing when you come in to see me, why I'm having you take off your shoes, why I'm asking you to see your eye doctor, why I'm such a hard case about your blood pressure and your cholesterol and this hemoglobin A1C that we keep talking about. I hope that gives you a little bit more clarity on that. If you have any questions about this, don't hesitate to give us a call, make an appointment. We'd be happy to sit down with you.